Let me to introduce myself. I'm an MD, a physician, and also a clinician, but beginning from the 1994, I'm in the Italian at the Italian NIH. Now I'm head of research in the Department of Oncology and Molecular Medicine at the Italian NIH. The reason I'm here is that I published a couple of papers showing the effect of fermented papaya on both tumor growth and aging. Then some molecular, characteristics of aging, including the telomerase length and telomerase activity. Okay, and I guess the results were surprising for me, and will be surprising for you as well, because they were in vivo experiments in which we administered fermented papaya by oral administration, and always we had results also against a very aggressive melanoma, actually. So let me to show you the results. So may I share the?
Yes.
Yes. Here. Okay. Can you see it?
Yes.
Yes.
Okay, let me to start from the very beginning. This is the title. The title is a role for fermented papaya in preventing and treating aging and cancer, cachexia, through a potent systemic antioxidant effect. Actually, just to introduce myself better, I had a past of gastroenterologist with research activity in mucosal immunity for up to 15 years, sharing this research activity with my clinical activity as well. And when I got to tumors, actually, I had this research activity in mucosal immunity. Then a research activity witnessed by some papers in HIV-1 infection. So when I got to tumors, I asked where we are, and the answer was very delusive to me, because both from the clinical point of view and the research point of view, I had a failure in front of my eyes. So I tried to find out other ways to treat patients, to manage tumor patients. One of my most important discoveries were that tumors can be treated with the anti-acidic drugs such as proton pump inhibitors, and together with the preclinical evidence that were very strong, we had 3 clinical trials showing that at least in combination with chemotherapy, proton pump inhibitors may improve the effectiveness of the chemotherapeutics. Also, my research activity was in tumors, was also in exosomes, nanovesicles research activity, and my group was pioneered actually the research on these very interesting nanovesicles that are released from all the cells, including tumor cells. But also I discovered some mechanism underlying tumor cell cannibalism, and I published a review on Nature Reviews in Cancer in 2018 on the stuff. But this is just to say that I have a very peculiar curriculum vitae in research that convinced me just to use fermented papaya to treat tumors, because the classical oncologists used to treat tumors with very aggressive drugs or targeting drugs. I guess you know it. Just to introduce the issue, I discovered that a very famous Nobel Prize that was Ilya Mechnikov, together with discovering the background of immune response, just discovering macrophages, discovered that in the Eastern Europe, there was people lived more than in the Western Europe. And he hypothesized that it was due to the fact that in the Eastern Europe, they used a high amount of the food fermented in their diet. So this is very important because also in Japan, there was the same thing. And we all know that the Japanese are the people that live longer than other people. And we Italian are the second worldwide, as you know. And they use fermented foods. And the idea just to use fermented papaya to treat aging and inflammation and to improve the immune response came from this habit of the Japanese people. So what we knew about immunage, the commercial name, the market name of fermented papaya preparation was immunage, is that, for instance, it has proven very effective against brain health, to improve brain health. And we knew also that there is it showed a very powerful antioxidant nutraceutical effect against various diseases, including tumors, and that it exerted a very convincing immunomodulatory effect as antioxidant. That, to be honest, due to my past as immunologist, I should say that we all have a very powerful immune response, but the problem is that the accumulation of toxics, including the oxidants, may break the immune response. And when you use antioxidant as a drug, or you induce as immunage actually does an antioxidant response, you can highly improve the immune response because you free the immune response from the oxidants. And this is very particularly true for aging people, because during life you accumulate a lot of oxidants, actually. So our first work was on the effect of fermented papaya in controlling cancer growth. And we compared actually the effect in vivo on cancer growth to the release of a very antioxidant response. And going straight to the results, we first showed that in a dose-response manner, fermented papaya controlled the growth of a very aggressive melanoma in mice. And as a clinician, I should say that the results was not only the control of cancer growth, but also the amelanosis of the tumors. And all the oncologists knows that the first response of melanoma to a therapy was the amelanosis. So the FPP controlled the tumor growth and induces amelanosis. And what is very interesting is consistently with the effect on tumor growth, we show the reduction of the plasmatic ROS levels together with the increase of two potent natural antioxidants, such as the glutathione and the superoxidodismutase. So we showed with this study that FPP was able to both reduce the tumor growth and to reduce the plasmatic level of ROS, together with increasing the GSH and SOD1 plasmatic levels. This is published, and the second study was on investigating the possible role of FPP in controlling aging. We used a model of mice, of female mice, in which we administered by oral gavage at the beginning, and then we prolonged the study with administering the FPP in the tap water that mice drank all the days. And we showed first that in the plasma of treated mice, there were the double level of total antioxidant in the plasma of treated mice, and in the plasma as well, very high level of telomerase activity. Then we examined two organs from the mice. That was the bone marrow, and the ovarian germ cells. And we obtained amazing results with the telomerase length, because in the treated mice, that telomerase length was the tribal in the bone marrow and in the ovarian organs as well. So we compared an early treatment to a late treatment, just in trying to evaluate whether the administration with fermented papaya was actually more effective as early as in our life, or it is the same when assumed later in our life. And actually, we showed that it always was better to assume as early as possible, because the telomerase activity was higher in both, but better when assumed earlier. That the telomerase length was the effect on telomerase length was very evident when assumed early as compared to the late treatment. But we know also that, of course, during the years, the telomeres used to shorten, and so to treat the very short telomeres is very hard in inducing an elongation. And the same was for in the ovarian cells, and also for the ROS level, because the ROS dropped down in the early treatment while we did not show any change when treating the mice later. And the same was for instance, the antioxidant power levels, and for the glutathione levels as well. So for the first comment of this study is that fermented papaya induced an increase in telomerase activity and telomerase length through the induction of a potent antioxidant body reaction. Then that the early treatment is much better than the late treatment. And the effect of fermented papaya was particularly evident as against telomerase activity, telomerase length, total antioxidant power, and glutathione release. And this is published as well. So as a medical doctor, just let me to say it at the end of this presentation that the real endpoint of medicine is to cure. That disease can be healed in principle, because we used to say with our colleague that the life is a chronic disease that actually may worsen during time. It is also sexually transmitted. So to heal is just to live by life. You know, it is impossible actually. But medicine may cure. And of course, fermented papaya may help. Another thing is that I want to say that actually our body is perfect because is an unrepeatable ensemble of imperfection, because it's a concentrate of the Darwin hypothesis. And our bodies is actually a complex and highly interconnected system, and unfortunately not so known. And another thing I want to say as a medical doctor, that it is very important together and to take an antioxidant or a nutraceutics inducing antioxidant reaction is to drink water, because the people used to drink very low level of water, and we all need to drink at least 2 liters daily water. And to drink less water is to not to do a good thing for your health. Okay. So what I suggest, of course, the suggestion of the grandmother: eat less and better, to drink at least 3 liters of possible alkaline water, and a daily physical activity, but also probably to take fermented papaya. And let me to end with a beautiful, some beautiful words of Bob Dylan lyrics: I let you be in my dreams if I can be in yours. Thank you.
Let me say, I was impressed because, Stefano, you sent in March, in springtime, a short communication to European Journal Translational Myology, in which there were very simple but impressive diagrams of the results in the mice, in the anti-aging mice. Why did you not present those pictures to us? You have in your computer.
I presented more than that, than what the
Yes,
picture that is included, more than together
but,
with the picture.
But let me have a chance to talk also about the European Journal of Translational Myology.
Yes, of course.
This was a trick for all the audience, nothing more than it. It was not a question to Stefano or a criticism to Stefano. It was just an opportunity to remember to all people that listen that we are looking for your communications, but even more to references to EGTM publication in your paper that you published in other journals.
Yes, of course. Yes, I will.
Yes, of course, but no one is doing it.
No, come on. It's, you know, we are under the COVID. Yeah.
How many times you cited your communication up to now?
No,
once, two,
I did
once,
not
two,
publish
zero.
any. No, come on. I did not publish any paper on FPP from that publication. So
in Italy, we say we talk to the grandmother to educate the nephews. I talk to you to ask the same thing to all the audience.
Yes, okay. First of all, let me to congratulate with you for the success.
Because we are 1.8 in the Scopus track. We are not far for a decent impact factor, but we need your help, of course.
Yes, you will have my help, always.
Very, very good.